Mr. Vincent, you and I serve on the state's Equity Council, and I think we can both agree that this for-profit healthcare system wasn't designed to support communities of color. It was designed to support the elites, those that were deemed to be more human than others, and it's been perpetuated. And the reason I say that is, why is it that we have all the data we need and we continue to see the disparities? We continue to see inequities. We continue to see poor health outcomes for women of color. And when COVID-19 happened, we saw a testing system roll out that required a physician referral. You know how many people didn't have a physician to refer them? Even neighborhood health plan was rejecting people because they didn't have a plastic membership card for a while. And then we had the vaccination rollout, and the governor knows I was concerned with the inequities that continue to exist today. And community members, over 100 members and organizations came together, and yes, with the resources that the state provided, but still community-driven, created on-site registration support for people. And you know how many languages we had ready? 20. You know how many languages they gave us at first? Spanish and English. That is the problem. We continue to have reactive administrations that do the bare minimum until we call them out, and we need things to change. We want to assess homelessness, then let's start talking about how the federal government doesn't count you as homeless if you live on families' couches. You know how many people of color live on their families' couches? Let's talk about education equity zones to assess the fact that we continue to have widening inequities in our education systems, and our education funding formula is inadequate. Let's start talking about environmental justice zones where we're actually going through assessments, continuous assessments, not one DEM, DOH assessment every 2 years, every single year to measure air pollutants and to figure out how we're going to support the communities that we have marginalized for years. Let's do the work, but let's actually do the work. Let's go on the ground and work with communities to implement these changes, because it's not going to be easy. It's not enough that we continue to say, like, I care about equity. We had a hospital merger. Who stood against it? I did. We had waiving of the contract requirements for minority and women-owned businesses in the Remuneration administration, and who was in office that stood against that? No one on this stage stood up when those were waived.